Hello, and good afternoon once again. Dr. Alalade here at Ask the Gynecologist, and this afternoon I'll be talking about endometriosis and how it affects infertility. So if you're free, join me. Let's have a quick chat together, okay? Let me quickly check my audio, and I hope you can hear me loud and clear here on all the channels. We are live on Instagram, live on Facebook, and we're also recording simultaneously for publication on YouTube. Once again, I want to say happy Eid al-Fitr, Baka the Salah to our Muslim friends and family on Ask the Gynecologist. Most importantly, I want to say I wish you all fun time during this celebration. And may God Almighty hear our prayers, hear your prayers, and also continue to bless you and provide for your home. So happy celebrations. I think most people now in Nigeria are on public holiday. People are on the beaches, amusement parks, and they're having fun and celebrating the time with family and friends and having wonderful soul time. Once again, my name is Dr. Jidoba at Ask the Gynecologist, and tonight, this afternoon, I'll be talking about endometriosis and how it affects and how it causes infertility. You're aware that this is your group on Facebook where we talk about female fertility concerns and we talk about how you can improve your health. Most importantly, by you being a virtual member of this group, listening to us daily, you're going to know more about how your body functions, as a woman, and also understand how to get the best from your body and address health issues as they might happen. You don't want to be caught unawares that you don't even know how your body functions as a woman. You want to know how everything, your ovaries, your womb functions. And tonight, this afternoon, I said, I'll be talking about endometriosis. And as I always do, I'm a teacher, I use my whiteboard here to explain things. And unfortunately, the board is on reverse. But once we publish on YouTube, it will be back to exact way. If you're not yet a member of Ask the Gynecologist, definitely for you being watching me, or for you being able to watch me here, you're already a member. You see, ATG is free. You can always watch our teachings like this every day. I and Dr. Esther talks about things, and you can watch everything we talk about free, consistently every day. But if you want that one-to-one discussion with me or with Dr. Esther, you can as well join the premium services where we can carry you along one-to-one. The premium services we've already published it, and we keep publishing it every day on our group. We have the different categories, about 5 of them. The weekly service, the consult service, which is for 1 month. We have the gold, the platinum, and the diamond as well. And we also have antenatal group on Telegram, where you can discuss with other women as well, going through antenatal challenges and also to know about how and what to expect during the antenatal period. And we also have the GTC group, which is getting ready to conceive, which is a much cheaper option as opposed to consulting privately, where you meet with Dr. Esther and other members as well in a general Telegram group. ATG is also working hard to ensure that we have our own IVF center, which we've already almost completed now. We open in June, where you can have IVF done at a much discounted rate in Lagos, on Lagos mainland. And it's sponsored by the ATG Women's Foundation, and it's going to be open in June. The ATG Women Foundation is a foundation by ATG, which is trying to subsidize IVF treatment and access to women, including all other ancillary treatments and other services, to ensure that a woman is able to get pregnant. We're opening that in June by the grace of God. And most importantly, we have a laboratory where you can do your infertility investigations. And the essence of the laboratory is that even if you just go there and do your infertility investigations, automatically my staff will give you the details of my WhatsApp number, and you can forward all your result of lab tests to me. But the lab test must be done at the ATG lab, and you can send it to me, and I'll review your results and get back to you with the answers regarding any test that you've done at the laboratory. I can see people watching already on Instagram, okay, and I can see our family members already on Facebook here. Damilola Odubela, wonderful lady from Ogun State. I can see Anita Chichijoke, wonderful lady from Nigeria as well. Amada Son Ehis Dixon from Edo State. Bumi Ajayi from Europe. Chinanya Anyanwo Ezema, one of our moderators, and Chidima Oji, Christina Oladumoye Idowu, both of them our moderators. And we have Oluwakem Solabamdele Feisayo, wonderful lady, and Olika Ebilekwe Ezeze, and Chidima Ada Onoha. Thank you so much. And Lily Marama, she's already also on Instagram here. And Glow Impeccable, Osaki1, thank you guys for being here on Instagram. Moses. So let's start talking about endometriosis. First of all, let me draw my diagram of what the womb looks like. So this is the womb, okay? Let's move this down here. This is the womb, okay? Wonderful womb. That is where everybody came from before we were born. And on this side, on either sides, we have the tube. Okay, on either side, we have the tubes, the right and the left. And we have the opening of the tube there, like the flower opening there. Okay, and on either side as well, we have the ovary. Wonderful ovary that releases the egg. And the ovary is attached to the womb there. Ovary here that releases egg attached to the attached to the womb wall there. Okay. Inside the cavity of the womb, okay, that is the cavity of the womb. Okay, so here we go. I think on Facebook here they can't see everything clearly, so let us move Facebook camera so they can see clearly too. All right, so now we have on YouTube there, and they can see a bit better from Facebook angle there. Good. And then on Instagram here they can see everything as well. Okay, now every month, let us bring this a bit closer so people can see this ovary on this side. I think on that side they can't see the ovary well, so let's put the ovary here. Okay, good. So the people can see the ovary on Facebook here. Good. So every month, okay, every month, or usually around every month, a woman has a period, and the blood will bleed out from the cervix here into the vagina. That's the vagina, almighty vagina, VJJ. Lovely, beautiful. Okay, now every month this wall of the womb, okay, builds up. Okay, you see that red I'm putting there? It builds up every month and it bleeds. If the person doesn't get pregnant, that wall that is so red and thickened will bleed out. But if there's pregnancy grows there and the womb gets big. Once in a while, for reasons we don't know, okay, this layer that I've made so thick, this one that you can see this black arrow, this one you can see this black arrow, this layer that normally bleeds out, okay, we call it okay, it can move and go and implant into the wall of the womb like this. You can see you can go and implant in the wall of the womb like that. Okay, and instead of it bleeding out every month, they can't bleed out, so they will cause a swelling inside the wall of the womb, big like this, everywhere, and that swelling can be very uncomfortable. After the period is over, all those black swellings, they will shrink back again. The next period comes again, they become big again. And become big again. Painful. After the period, they shrink back. All those black dots in the wall of the womb, which is the normal layer here that normally bleeds out every month, when they move into the wall of the womb, for reasons we don't know, they cause what we call adenomyosis. And they can be very, very painful and very, very uncomfortable. It's not fibroids, though. It's adenomyosis, when the wall of the womb moves into the womb, when this layer of the womb that bleeds every month moves into the wall of the womb, and they go and implant, and they swell every month, and they shrink after period, is adenomyosis. Okay, they cannot bleed out like their cousins that are in the womb wall inside, but they will bleed into the wall of the womb. But because they can't bleed out, they will stretch it and they'll cause pain. It's called adenomyosis. This adenomyosis, they respond to the estrogens that are produced from your ovary, just as the same way your womb responds to estrogen. But this layer, okay, so what I'm trying to do is, if I cut out this layer out, this particular layer in circle, okay, this is what you see. Let me make it bigger. See this layer? So this is the wall of the womb, okay? This is the outside. This is your bowel. This your bowels, they are here. Your bowel, they are here. So this layer is outside your bowel. This is the wall of the womb, and this is the innermost layer, the one that I said that bleeds every month. So I've made this open. So I've blown it up. So this layer is this one. Inside this wall, you have all these black bits there. That is the adenomyosis. Okay? Every month they swell. After the period is over, they shrink. They are under the influence of this same hormone, estrogen, produced from the ovaries. Okay? But because they can't bleed out into the womb, into this cavity and bleed out into your vagina, they will cause pain when they stretch. Okay? They'll cause pain when they stretch. That's adenomyosis. Their other counterpart and cousin is endometriosis, which is the topic for today. Instead of this layer here that I said here on this wall, this layer, this one, which is same as this one, instead of them moving into the wall of the womb, they can also move outside and implant outside the womb. Like this. See them? They can implant outside the womb like this. Okay? That is endometriosis, outside. They can even implant on your bowels. They can even implant on the ovary. They can implant on the tube. They can implant on the outside of the tube, what we call the fimbria end. They can implant on the tube there. You can see them here. On this sample here, you can see it on the tubes there. See there on the tubes. On the tubes there, you can see that endometriosis on the tubes there. Those black dots. That's endometriosis on the tubes. When they implant on the ovary, we call them endometrioma. Endometrioma is endometriosis on the ovary. Endometrioma is endometriosis on the ovary. So we got three things here now. Adenomyosis. Okay. A for adenomyosis. E for endometriosis. And E for endometrioma. So that's endometriosis and endometrioma. This one is adenomyosis. Okay? Adenomyosis, endometriosis, endometrioma. They have the same common origin. If they move into the wall of the womb, it's adenomyosis. They make the womb bulky, spongy. They make the womb horrible. It's not fibroid though. Fibroid is when you have growth from the wall of the womb, like that. It can be outside, in the wall of the womb, or even out inside the cavity of the womb. That is fibroid for you. Okay, polyps is a bit different. Okay, when you have growth of the womb layer itself. Okay, but this is fibroid, polyp, adenomyosis. So women have got a lot of issues sometimes with health-wise. But the good thing is that we know a lot. Not everything, but we know a lot about what makes a woman have medical issues like this. I hope you're still following me. Okay. So you understand what adenomyosis is now. When the layer of the womb that normally bleeds out every month, they move into the wall of the womb. Adenomyosis. If this layer moves outside and implants on your womb wall outside, becomes endometriosis. Okay, let me bring this closer to you. You can see all those black spots in the wall of the womb. That is adenomyosis. You can see that those black spots inside the wall of the womb, that is adenomyosis. See it here, adenomyosis. Now, how does this all cause infertility? Because that's what you want to know now. Now, doctor, I know all these things. I'm confused. How is it going to cause infertility? And how does it affect me? Now, follow me. This endometriosis outside these tubes, like this, okay, they are very bad. What it causes is that they make your tubes not able to move freely. Okay? When the tubes are able to move, they can pick up eggs released. When the tube is free to move, they can pick up eggs released quickly. Fast. So egg is released, they pick it up. They pick the egg up. Easy. But if the tubes are not able to open and close and open freely, they have difficulty being able to grasp and suck in the eggs. Okay? Because endometriosis can be anywhere on the tube. They can be anywhere on the bowel. They can be even as far as even in the lungs, where some people they cough and they cough blood when they're having period all the time. Anytime they're having period, they cough, they have blood coming from the cough. It can even go into the brain. Endometriosis can go anywhere on the liver, in the brain, in the lungs. They are so bad. They can move anywhere. Only God knows why they do that. They can move through what we call the lymphatic channels. Okay? Or even through the bloodstream. But they can move through many mechanisms which we don't fully understand. But not all endometriosis causes infertility. Some are just there on your womb surface there, and they don't cause you any problem except small concern during your period. And this endometriosis too, they are very funny. Some people will have a lot of endometriosis and they don't have pain at all. Some people have so much endometriosis and they have so much pain. Some people have only small endometriosis and they're not in pain. Some people have only few endometriosis and they're always in so much pain. And endometriosis also is very notorious in that it's also associated with irritable bowel syndrome, IBS, the popular IBS. Endometriosis is also associated with IBS too. But let's go back to why it's causing infertility so we don't digress and go off track. Endometriosis, once it affects your tube, this outside your tube here, it will make the tube stuck together so that this opening end of the tube cannot open well. You see this open end of the tube, this open end of tube, that is like flour. That open end needs to be free to catch egg, It needs to be free to open and catch egg. Like that, sucking the egg. So if this opening here, they have endometriosis on them, they won't be able to move well. They'll be stuck. They will move like this. They can't catch well. Sometimes even they are close together and they can't open at all to catch the egg. When endometriosis affects your tube, they cause infertility. When endometriosis affects your tube, they cause infertility. And these endometriosis too, they are so bad in that they can be so severe, what we call grade 4 endometriosis, that they affect almost every part of your bowel. They will seed and they will just contaminate and stuck to the outside of your bowel surface, okay? And your bowels, everything is stuck together. We call that frozen pelvis. Frozen pelvis. And your bowel, your womb, your tube, everything is stuck together like a block, like ice block, like traffic jam. Nothing is able to move freely. The tubes can't move freely. The eggs can't move freely. The egg is stuck behind the womb. Everything is stuck. So much so, whenever you're having sex and your husband is pushing in and out, is pushing everything is stuck together. Everything is moving together, and it's causing pain because it's not free. The body loves things to be free, to move freely. Endometriosis will make everything stuck together like a block. Everything is stuck together, and they are moving like this. The tubes can't move freely to catch eggs. The eggs can't move freely about. Everything is stuck together. In endometriosis, some people, the tube is like, let me draw this for you. You see let's clean this place up and let's draw something here. Hope everybody can see from all angles. People can see from here, from Instagram. Let's change this camera. Good. So some people, in endometriosis, their womb is like this. The egg, there's ovary is like this. The tube is stuck like this. Tube is stuck like this. Everything is not free. Stuck together. You see the bowel is stuck everywhere like this. Everything is stuck together like a block. Nothing is able to move free. And the woman can't get pregnant because everything is stuck together. That is what endometriosis can do to people and make them unable to get pregnant. For such cases, the next question is, doctor, what do I do? First of all, there's no way anybody can prevent endometriosis. That's the honest truth. Because to prevent it, that means that you have to take out your womb. How do you prevent this layer of your womb moving out? Nobody can prevent it. Nobody can predict it. But we know that in a family where mothers, sisters, they have endometriosis, there's a slight increased risk of other female siblings also having endometriosis as well. We know that. But there's no way you can accurately to go and take steps to prevent endometriosis. And how does it prevent? People prevent with pain during sex, pain during period, and after the period is over, the pain dissipates away. People present sometimes with infertility. They can't get pregnant if it's so bad. Some people too, they have bloated tummy around the time of their period. When that happens, we start to suspect that they might have endometriosis bothering them. And how do you know? To know whether somebody has endometriosis, one option is to put a camera through their belly button. We make a small cut around their navel button here. We put in a camera called laparoscopy, and we see with clear vision, with light, everything magnified. We can see those dark things, endometriosis on your bowel, on your womb wall, on your ovary, on your tubes, and we try to remove them. In some cases, this endometriosis will get stuck to your bowel that is impossible to even touch them, because if we touch them on your bowel, we'll probably damage your bowel. We leave such alone. We remove endometriosis as much as we can remove. Okay? If removing them will cause too much damage to your bladder, if they're in your bladder, or if they're in your bowel, if it will cause bowel perforation, we leave those ones alone. Those ones invariably might not cause infertility, but they'll cause you discomfort. Some people with endometriosis, they will even have blood bleeding during their period. They have recurrent blood. Whenever they're having period, there's always blood coming from the bladder. They have problem with their bowels. To open their bowels is painful because everything's stuck together. The bowels can't move freely. Everything is uncomfortable. So if we see that on laparoscopy surgery, we try and treat all this and burn off all this endometriosis with a laser heat source. But sometimes if they're implanted on your bowels, we don't touch them, because if we use that heat source to remove them from the bowels, they'll probably cause bowel damage, and we don't want to cause bowel damage. We don't want to turn your tummy into a sewage tank. The bowel is like a sewage contained. If you bust the bowel, you turn the tummy into a sewage tank, into a sock away. Nobody want to do that. So if your endometriosis is on your bowels, the doctor will probably leave it alone. In few cases, where such things like this happen, everything is stuck together. We put in the camera, we can't even do anything. We have to come out straight away and not do anything, because if you try to do anything, you can't dissect all the organs. Everything is stuck together. We leave it alone. In some cases, if we have this kind of problem, what we tend to do is that we give you and we put in a Mirena coil into your womb cavity. The Mirena coil contains progesterone. It's a T-shaped coil, very small as my fingertip like this. We put in the coil in your tummy, containing progesterone. It helps to counteract the effect of estrogen from the ovary on the endometriosis. If you have endometriosis on your ovary and has become a cyst, what we call a chocolate cyst, we'll try and remove it. So some people, they have this endometriosis on the ovary like this. Okay, so every period they have, the bleeding will bleed into that cyst. It will go down, but every period it gets bigger. So if you're having pain on your ovary, that gets worse, and it's getting worse with each of your cycle. It's getting bigger, and it contains blood, old blood that is so black and dark, looks like a chocolate. That is chocolate cyst on your ovary, endometrioma. If you just come into the lecture, you can watch the video all over again. Okay, it's going to be on live on Facebook for a long time. Bowels is intestine. Somebody is saying, what is bowels? Bowels is your intestine, your guts, your intestine. When you're killing your cow for the salad break, that thing you bring out from the tummy, that is like plenty worm, is bowels, is intestine. Okay, intestine. If the endometriosis affects your tube and the tube can't open freely, to catch egg, it can cause infertility. If endometriosis affects the whole woman tube and the tube is stuck together around the womb, the tube can't move freely to go and pick up egg, everything is stuck together, it can cause infertility. In some cases, we try and open you up to remove all the ones we can see physically as soon as possible. And in some cases too, they can come back again. But if you're trying to get pregnant, what we can do in most cases is to try and remove everything we can, try and free all the organs as much as we can, and then hopefully you get pregnant. If we cannot free everything and everything is stuck together, and we cannot get eggs that is released to enter into the tube, the next option will be to consider IVF, where we retrieve your eggs from your ovary and we put in the egg, fertilized with your husband's sperm, into your womb cavity through IVF. And in some cases, if the tube has been damaged, your tube has been damaged from endometriosis, the best will be to remove those tubes, because if you don't remove them, they're going to increase the risk of you having a ectopic pregnancy, which could be life-threatening to you as well. Now, let's take questions here on Facebook and on Instagram. There's a question here from Inkiru Nana. Doctor, I went for hormonal test. The results are LH hormone 4.5, FSH 4.0, and so on and so forth. Inkiru, your results are okay. Very good. What you need to do is to do day 21 progesterone, check your husband's sperm count, and check your HSG to ensure that your tubes are not blocked. Okay? Thank you, Inkiru. Thank you, Falashade. Thank you, Emi Ikatwa. Thank you, Falashade Oji. God bless you. Thank you, Folake Ajala, for coming on live. Banki Shadia. Keve Esther. Okay, Dario Shaw. Ammonia Green and Deyinka. You're always here all the time. We are on live. Thank you, Ammonia. God bless you. Wonderful lady there. And Damelola Dubela from all the way from Nigeria. And Nita Chijoke. And we have here Amadashon Ehis Dixon. Thank you guys for being here. If you have any questions, pop your questions now. Let's answer them. And I'll pop out again because I need to get back to work. Okay, God bless you so much, guys. You can watch, if you're coming live late to this program, you can watch the video later when you're free at your own convenience. Thank you, Chinenye Anyanwu Ezema and Chidima Oji. I can see you, Christina Odumo, Oladumoye, and Babamidele Kemisola Feisayo. Thank you, Chidima. So there's a question here on Instagram. Z-Line. Doctor, my HSG says my uterus is deviated to the right side. They guessed the fibroid, but it wasn't. What could, if it was, what could it be? Your tubes are open. Z-Line. The purpose of HSG is to check if your tubes are open or closed. As far as the tubes are open, that is box ticked. That is good enough. If they're thinking that your womb is tilted or anything, what you need for henceforth is to do a scan to check if there's any particular issue with your womb tilted or not. The purpose of HSG is to see if your tubes are open or closed. That is to see if they are patent. And if it's patent, case closed. That's all done. Doctor, please, for a man who's completely okay, but the woman doesn't produce egg. So between ICSI and IVF, which was preferable? IVF. ICSI is when the man has problem. But you say the man is completely okay. So if the man is okay, they don't need ICSI. And if the woman doesn't produce egg, they need IVF. And if you need IVF, you can contact our laboratory. We're going to open June for IVF at ATG IVF Center, sponsored by the ATG Women Foundation. You've been battling with endometriosis for 13 years now. You're still single. You don't know what to do anymore. Contact me via the premium services and I'll take it from there with you. There's a question here from Accra, Ghana. My wife is menstruating now, but there are drops of blood, clots, and dark spots intermittently. Could this be the endometriosis? No, that's not an endometriosis. Okay, that's possibly fibroids or polyps along with your wife. And it's important that your wife does also cervical smear test to check that there's no issues with her cervix. Nkiru, I already answered your question on Facebook here. Mary Godwin, you have a posterior intramural fibroid measuring 5 centimeters. Can it cause miscarriage? Very unlikely. You've had 2 losses in first trimester. But if you have this big fibroid like this, 5 centimeters, I suggest you take it out, okay? Anyway, regardless, before you start trying again. Ijoma Aju, doctor, what can cause someone inability to conceive after she went for test and they said there are scars in the womb? If there are scars in your womb, what it means is that, so if there are scars in the womb, what it means is that maybe you've had a previous DNC or some treatment or some operation in your womb, and instead of your womb being open and free like this, there are scar tissue inside, okay, from the healing process of the womb, and it's difficult for egg to implant. So what we do is that we resect and take away all this scar tissue through hysteroscopy. We take them out as much as possible through hysteroscopy. Okay, that's what we need to do for you. Okay, very good, excellent. Can this condition cause breast to lactate after 6 years of winning first child? No. Endometriosis hasn't got anything to do with lactation. Okay, no. Thank you for that question. Doctor, you did HSG last year. Your tube was open. For how long can it last? As far as God is happy for your tube to be open. You've done HSG, your tubes are open. How long can it last? As far as God wants it to be open for, okay? And don't get an infection. All right, thank you. I've answered a question, Z-Light, okay? Let me see if you got any other question on Instagram. And Instagram here, is there any negative effect for not doing PGTA during IVF process? I don't know what you mean. Maybe if you mean PGD, to do genetic diagnosis. PGD is to know if there's any diseases that have been transmitted from the host or from the donor egg or sperm, to see is there any genetic disease that this baby might get. So if you want to do PGD, you do all the tests. They're expensive though. But if you don't want to do them, then you just forget about it, because that means that you don't know if there's any genetic disease that's been brought on from the donor. That's all. But if you know, you know. But will that change your decision to go for egg donor? It's up to you. Some people will say, even if I know, it's not going to change my decision anyway. So they don't care to do that. Some people will say, if I know, I might change my decision. So if you're like that person, then do all the tests that is available, and then you move on. Okay? How can you improve egg quality? Especially for over 40. If you're over 40, you want to improve egg quality. Now, mark my answers now. There are 2 things about egg. Are we increasing the quality or are we increasing the quantity? Is it quality or quantity? If it's to increase quality, you can use antioxidants. For example, the DHEA, CoQ10, and so on and so forth. But to increase quantity, I don't know. I don't know, because once a woman is born, the amount of egg they carry all their life is given to them by God. It cannot increase in quantity, it will only decrease as they get older. I can't reverse age. But what you have left, we can preserve it and make it to have good quality by living good healthy lifestyle, balanced diet, regular exercise, and taking some antioxidants that can slow down the aging process and preserve the quality. But the quantity, I don't know how to increase quantity of egg. Doctor, you had the ovulation on 11th day of your cycle. The cycle is 28 days. When do you see your period? If you're having a 28-day cycle, you see your period the next 28 days from the first day of your bleeding. Okay, good. You can also subscribe to our services if you want one-to-one consult. We have different services. We have the gold, we have the platinum, which is video consult. I talk to you physically one-to-one on video. We have the diamond service where you can call on diamond. You can call through WhatsApp. We have the gold, which is only via text. So many of them like that. We have the consult service for a month and consult for a week. You can choose any one that suits you, and you can consult with me privately at your own free time. Bolatito, I've already answered your question about quantity of egg for over 40. Bolatito Omodolakbo Dauda, I've already answered your question just now. You did a Chico Dili, Maristella. You did follicular test. The result says the follicle and ovaries are seen, but no leading one. What should you do? Repeat the scan in your next cycle, okay? Repeat your scan in your next cycle to check, or at least do your hormone profile to see if you're ovulating. Somebody saying they've been taking clemastone for 2 years now. I want to stop it because you want to get pregnant. What can you do? Then stop it now. If you're taking it for 2 years, you want to stop it, you want to get pregnant, then stop it. Stop it. That's all. Stop it and then start trying for pregnancy, having sex every 2 to 3 times a week. That's all you need to do. Doctor, you used to feel pains in your navel around your period. You might have endometriosis, okay? So probably consider getting laparoscopy done to check whether you have endometriosis. Can someone get pregnant with adenomyosis? Yes, you can get pregnant with adenomyosis. You can get pregnant with adenomyosis. You can get pregnant with adenomyosis. Thank you everyone for listening to me today. I really appreciate you. Hope to see you again tomorrow. God bless you. Have a wonderful day and have a wonderful weekend as well. And have a wonderful Salah break as well. God loves you. I love you too. Bye-bye.